more understanding.
Yeah. And I think it's important for the therapist to know when the threshold into dysregulation has been crossed, either when they've gone into hyperarousal or hypoarousal. And sometimes hypoarousal's more difficult to notice.
Yeah, when someone's switching off.
Yeah.
So what are you looking for in the body then, Maggie? What, for those thresholds?
Well, I might notice like changes in skin tone. Depending on how close I am and how the light is, I might be noticing pupil responses, the size of the pupils. How they hold their body, the state of tension or relaxation they may have. Lack of eye contact is an important one. The breathing rate changing, maybe sometimes becoming quite shallow. So that, there's lots of maybe some other kinds of things like sweating, changes in that kind of thing.
Yeah.
And more obvious ones, like agitation and.
Yeah, like you can see someone moving in their chair, or suddenly they push their chair back or something, or
Yeah. I think it's important that therapists notice these things because, as I say, often what happens in couples when they get dysregulated, or when one person gets dysregulated, is the other partner will say to the partner, "What's wrong with you?" Right? And the last thing you want to do with anyone who's in distress is to ask them a question, especially one that they can't answer. Yeah. So when the partner notices that their partner's getting a bit dysregulated, and they're able to make, a kind of guess about what's causing the distress, and to make statements that are soothing, it communicates a few things to the partner. It says, "I've noticed you." It says, "I know that you're feeling vulnerable just now." It says, "I know you enough to know what you might need just now without you having to tell me." Right? Now, I used to say to couples clients, you can't expect your partner to be a mind reader. You have to tell them what's going on.
Okay.
Right? I think I've really changed my stance in relation to that. And I think that, well, they might not have to be a mind reader, but they do have to be a body reader.
Now that's a really interesting distinction. Yeah.
Yeah, they need to be able to notice that something's changed in the partner and to respond to that.
Yeah.
They have to know their partner enough to know when they're not okay, and to reflect that back to them, as I say, and and kind of make a guess at what the source of that distress is. To make an empathic conjecture, if you like.
Well, I think this is important for us as therapists too, because I mean, it's the cliche therapist question: how does that make you feel? But some version of that, when the client is dysregulated, the brain is switched off, it can create further shame and distress.
Absolutely.
When we think, the client
they don't know how they feel.
They
don't know how they feel. So and it might cause, as you say, John, shame that they can't answer the question.
Oh yeah.
Which causes more distress, which adds more distress.